Hello, we're going to first talk about injecting the neck, and I like to use hyperdilute Radiesse in a 4-to-1 dilution. So that gives me 6 cc's of a combination of saline with lidocaine, 2%, and then 1.5 cc in the syringe. So it gives me a total of 7.5 cc. So I use 5 different injection points. I use 2 laterally and 1 medially and 2 over here. So each of those is going to get 1.5 cc. So this is an outline of the SCM, the sternocleidomastoid muscle. And I choose my first point at the sternocleidomastoid muscle. And I make sure using the long cannula, I use the 22 gauge 50 millimeter cannula. And I choose this using the easy guide. That's my first insertion point. And then my second insertion point is about 1.5 to 2 centimeters below. And then my third insertion point's more medially, and I get the submental area and more of the central neck. So let's get started. Okay, so I'm using the 22 gauge 50 millimeter cannula. I'm using the easy guide system, and I insert it just through the dermis. I'm using the red dot upward, and I insert it into the skin. So my goal is to get the product superficial to the platysma, and I have to stretch the skin out to get that plane. It should be a nice glide plane. I go all the way to the hub and I do a small retrograde injection. Then I redo the direction and I continue to do the direction here. So it's a fairly comfortable procedure and it goes fairly quickly. Make sure that when you mix up the Radiesse, the calcium hydroxyapatite, you do it right before you start. All right, red dot up. You go towards the midline, retrograde. So this is a collagen stimulating procedure. Sometimes I combine this with radiofrequency. Other people combine it with HIFU, high frequency ultrasound. So this is the more medial injection point. And this also causes some tightening as well. It's just, and it causes collagen and elastin formation. So that's the unique part about Radiesse. So it's important to stretch the skin to help you get your plane right. But you just see the cannula right beneath the skin. Stretch the skin, yep. Make sure you do several passes with very thin amount of product to get the best result. We're doing another demo with her soon.
Are you?
Yeah. It's important you come nearly all the way out to redirect the cannula to find another channel. we're going to enhance the jawline as well as the pre-jowl sulcus, the deep lateral chin fat, the marionette, and the radial cheek lines. So part of this is done deeply and part of this is done superficially. If you notice the back part of her jaw, she's lost some of the bony architecture of the jaw. So I actually have to go beneath the jawline to correct that. Right here is the jowl, and it's actually a little bit lower than the jawline. That's going to become our new normal. And I'm going to pick that point as my entry point because that makes it more difficult to actually inject it with the cannula. I do not want to enhance the jowls whatsoever. So I'm going to first go in the superficial subcutaneous plane and go along the underside of the jaw and then go below that to make it equal with the jowls. And sometimes I actually go into the angle of the jaw as well with that injection point. Then I'm going to switch it around and I'm going to switch planes. I'm going to go deep to the SMAS. I'm going to go along the periosteum into the pre-jowl sulcus. She has a pretty good chin. I'll put a little bit there though. And we'll do the deep lateral chin fat as well. Then we're going to do a more superficial injection to correct the marionette line. And I do a little subcision on the pseudotendon between the DAO muscle and the skin. And then I'm going to do a superficial injection in the buccal area here for these radial cheek lines. We will come over here afterwards. 3 gauge, 70 millimeter cannula. And I'm choosing the lower point of the jaw as my entry point. Over here, which I didn't mention, is the antegonial notch, which are the vessels. So I'm anterior to that. I'm just in the subcutaneous tissue. And I'm using a high G prime filler, which is restful and lift. And now you spread the skin out to get into that glide plane. And I'm right here, just beyond the gonial angle, and I'm doing a retrograde injection. Retrograde injection. And keep going a little bit lower with the injections. To build up the gonial angle and to build up below the jawline. Does everyone see that? This is pointed upward. And now I'm going a little bit beyond to build up that gonial angle a little bit. But being in this plane, you're superficial to the vessels, and that makes it safer. And an avascular plane. So I'm now using a 25 gauge, 40 millimeter. I'm using the same entry point. And now what I'm doing is I'm lifting, because I'm going in through the SMAS and along the periosteum. Okay, and I'm going to turn the red dot downwardly. And I'm filling that pre-jowl sulcus. I'm always moving. And then I'm going to start to fill that lateral chin fat. And now if I go a little bit more, although she doesn't need too much, I'm going to put it into the chin. And I'm in the midline right here. And I'm going into the chin. So I can do that all from the one entry point. Okay. Now we're going to do a little more superficial, but this is the deep injection. Do a superficial injection. I'm going back to my 23 70 millimeter. Keep in mind the vessels go here, so I'm going to go behind these vessels. I want to improve the structure of the skin integrity, and this is going to be with the red dot up. Stretching the skin gets it into that superficial plane. Okay. This is something I learned from Sandrine. And I'm doing just a very superficial subdermal injection in the marionettes. Okay, and it's going to help these lateral cheek lines as well. So she likes to do this the whole face with a long cannula in this. So I'm going to go in the area of the ergotrid, which is above the lip, nasolabial fold. And this will give her a good numbing for the lips coming up next. So I'm superficial to all the vessels, so I'm pretty safe here now. Vessels are going to be deep to this injection. So this gives an overall improvement in the skin quality. So I'm doing the corner of the lips right here. So Refine is a very good superficial filler. Has great tissue integration. It helps with expression, areas of expression. Okay. And as the lifts, you come a few millimeters away from the commissure. Remember that the facial artery is going to be between 12 and 15 millimeters from the commissure, so you have a little space. Whenever you use the Easy Guide system, you want to make it tangential. You don't want to be forcing it deep. You want to just lay it on the skin. It has a perfect angle. So now I'm going to use the red dot upward. I'm using a 25 gauge 40 millimeter. I know that Sandrine likes to use the 27 gauge. I like 25. And now I'm going to put this along the vermilion border. Okay, and I'm milking it along, and I come to the Cupid's bow area. Dot up, and I do a retrograde. I'm using Restful and Kiss here. And then I go a little bit more inferior. Do you see the cannula? It's in the submucosa. That's the area where you want to inject, submucosa. And as I say in the past, I like to do a tadpole technique. So a lot at first, and then I gradually use less and less. So now we're going to go to the inferior portion of the lip. Open up for me. And I go along the vermilion border. And I'm milking it. And I'm right here. Dot up. And I'm coming along the vermilion border. Now one last pass here to the midline. Remember, you don't inject all the way laterally in the lower lip. You stop about right here. And I have a little bit more left. And there you go. Close for me. Look at the two sides. Much better. So along the vermilion border, subcutaneous. Red dot up. Retrograde it. And I can go a little more inferior. And then you switch it and go inferiorly. Red dot up. Do you see where I am? I'm submucosal. And then again, I'm submucosal. I'll put a little more in the upper lip. So in this jawline, you see that the angle is blunted right here. And we'll look at the other side here. And we have a nice gonial angle here compared to the other side. So you have to fill in this little triangle that's underneath the gonial angle to get the best results. Do the 23 gauge, 70 millimeter. Easy guide. Red dot up. Spread the skin. And now it should go immediately back. Now I'm below the jawline and I'm doing retrograde injections here. So see, the neck skin used to be facial skin, but because of the loss of the bony architecture of the jaw, it's now neck skin. So now I'm creating a neo-gonial angle using Restylane left here. This side was a little bit more in need of correction, so we might do a little bit more, like right in here. The antegonial notch sometimes needs filling. This is where the vessels are, and sometimes the antegonial notch needs a little more filler. So now I'm just putting a little bit more underneath the jawline here. You need a high G prime filler for the jaw. And now you see we're finally getting to be looking like a jawline on the other side. It's not uncommon that one side needs a lot more than the other. And it's not uncommon to use a lot of filler too. Sometimes 3/4 syringes per side are needed, but I probably limit it to about 3, 2.5 per side per visit. So now you go and you just go into the subcutaneous tissue and you turn it around, you're lifting up, and now I'm in the deeper plane along the periosteum. Red dot down, and now I'm in the pre-jowl sulcus. And now I'm in the deep lateral chin fat. You can get all the way to the chin if you need to. I'm right here right now. Deep lateral chin fat is right here. And that's where I do bolus. So again, the vessels are here, so you want to stay behind them when you do your insertion. Red dot up. Superficial injection here with Restylane Refine. Spread the skin, and you do small retrograde injections. And now I'm up here into the ergotrid and nasolabial folds. And now I'm down here in the Marionette area. And just giving the skin an extra boost, strengthening that skin so that when she smiles, these radial cheek lines don't show as much. She has some thin skin in some areas, and so we need to bolster it with Restylane Refine. You can get all the way, and Cedrine does this, Dr. Saban, you get it into that pre-jowl sulcus. You can do a little bolus down here with this. She can even go into the lips, and I'll go a little bit into the lips from here too, if you wanted to. But I'm not going to do that, but she does actually get into the lips. And you can actually go across the midline. So now I'm over here to fill that entire lower lip through one side. Make sure you're in the subject because